today. Good afternoon and good evening for someone. So we have three topics to cover today, and I think these are very exciting topics on our plate today. First, we have Odyssey News, and then we have Odyssey Indonesian team today. This will be our very first official session to introduce them to the community, so I'm very excited. And we will kicking off our 2026 Odyssey APAC study with dedicated kickoff session. For the news, the Odyssey Euro Symposium will be held in this weekend. There are dedicated tutorials and working sessions covering some high impact areas such as oncology and question and answer pairs on OMAP, which is they're dealing with the standardized patient reported and survey data, which I'm very interested in. And also they are doing an AI challenge that puts human expertise against the machine learning in mapping source codes to standard vocabularies. And I'm very genuinely curious to see how that really plays out. So anyone who's going to Euro Symposium, please go and share your story to our community. And I'm very excited to put you guys in the community call schedule too. And also there will be a showcase for Inspire. No, I mean like Indicate project, developing a European infrastructure for federated intensive care research. Okay. Um, I I'm hearing some noise here, so let me just wait for a second. Yep. And that's it. And also we have Odyssey Global Symposium. Everyone knows that it's October 20th to 22nd. And we have Odyssey APAC Symposium on November 13th to 15th in Yonsei University, where I am right now. So everyone, please keep your schedule in that time so I can see you guys, everyone, in Korea and Seoul. And I heard that Nali and Septi has something to give us a announcement of a upcoming event on July 18th in Taiwan. So Odyssey Taiwan team is organizing this event, and I want to um, um, set the floor, toast the floor to Septi or Nali to introduce or give some more details about this event.
Yeah, thank you, Jiwon. So yeah, hi everyone. So I just want to take just a moment to share our event that will be coming up this summer that we think many of you maybe want to be part of. So we will have 2026 Health Data Science Global Summit Forum. That will happen on Saturday, July 18, right in Taipei and at Taipei Nanggang Exhibition Center. So, and this forum especially is organized by Odyssey Taiwan Society together with Taipei Medical University and also Taiwan Bio and Industry Organization. It's a full day event until 3 in the afternoon, and we'll bring together experts from government, academia, healthcare, and industry all under one roof. And yeah, the focus this year is three big themes, which are real world data and evidence, innovations, ecosystem, and network, and clinical application of health data. And the program include keynote speech, experience sharing session, and poster presentations. So whether you are a researcher, a clinician, or someone working in data or biotech space, yeah, you are so welcome here. And yeah, just a few important dates to keep in mind. Abstract submission are open now until May 20, and registration also already open run through July 17th. So if you're interested in presenting, please don't wait to register or submit your abstract. And you have until May 20 to submit, and we'd love to see as many as you there here. I mean, and for full detail, you can access the QR code. Yeah, maybe I'll drop the link in the chat. Okay, yeah, we hope to see you all in Taipei.
Thank you, Septi. So the abstract submission due is until May 20th, right? Okay.
Yes.
Anyone who wants to go to Taipei and see Septi and Jason, please
Yeah.
join this
Yes.
forum. Yeah,
It'll be
thanks.
so hot in summer in Taipei. Keep in
I know,
mind.
like July,
Yeah.
it's gonna be like scorching hot, right?
Yeah.
Okay, and next, so this is another Odyssey news like updates, and the that we like the this dashboard website was actually disappeared for while. I guess like last year, Song and I spent quite some time trying to like track it down, and now I think it expanded to cover not just publication because last year the dash.org odyssey.org website just covered the publications, but now it's covering like more than publications, but also like a video and discussion and etc, and also repositories. So it's becoming more like really convenient, one-stop shop, so we could cover all the granular like Odyssey informations. So I actually use this website, and so there's a little sidebar menu, so you can just click it, and then you can go through the if you can click the website here, then there are like navigations bar along the side right here, and so if you click through the each menu items and categories, then you can find the full articles or videos or archives and more. So if I have more time, I'll be happy to share how to use this website. But we have a lot of topics to cover today, so gonna briefly introduce this website. So anyone who wants to see very newly updated publications, please use this website. I think this is pretty user friendly. Um, Platform for now. So this is it. And I'm very excited to announce that we have a brand new Odyssey APAC chapter to introduce today. And this is, I think, and also very safe to say this slide will overdue for update because I found, I'm not sure, Lafan, Lafan, I found some pictures from the Google, and I don't know if you like it, but now we have to add another chapter list here. So that's it. So I really want everyone give a huge round of applause to Lafan, Dilla, and Anisha. So yeah, yep, there you go. I'm gonna hand over the floor to Lafan or anyone who's ready
Yeah,
to present. Yeah.
yeah. Thank you, Jiwon. So, very good morning, everyone. Good afternoon also, from probably some of you. So, my name is Lutfan Lazwardi. On behalf of the entire team, I would like to introduce the ODC Indonesia chapters, our newly established community that hopefully can contribute also to the global ODC network. So, okay, so well, this is actually the structures, the peoples that engage on this initiative. We basically have a multidisciplinary team that involving academia, hospital, as well as also government, and supported by also advisor from both Indonesia and also from the regional ODC community. And I've actually been asked to lead the team, and I'm grateful that we are supported by a lot of team members that are listed here. And I think this team will also grow, and hopefully then we can actually contribute to make the community have impactful and also the um, have meaningful activities as well. So next slide, please. So this is the, well, we actually applied in January 2026 and officially joined in February. And this initiative is actually was started through what's so called AHS, the Academic Health System, which is actually an integrated partnership in Indonesia between the university, healthcare providers, and also policymakers from the health office And this basically will try to align the education's research to be actually translated into the healthcare facility and with the aim to improve the health. And currently, we have 9 hospitals on the network, and I'm very sure that it will also grow by the time, and hopefully then can have a yeah larger network with a meaningful impact also. So, and in this occasion, I would like also to sincerely thank to everyone from the ODC community for your support, which has then enabled us to finally join this wonderful community. So, this is the proposed activity. Our main focus this year, I think, will be more related on the data standardizations, collaboration, as well as also expansions of the network. And we acknowledge that some of our team, including myself, is relatively new on this concept. So I think in this proposed activity, in the initial phase, we will also focusing on strengthening our internal capacity, and also yeah try to learn more about this. And we are lucky that our some of our team members actually now uh, at the TMU, Taipei Medical University, that they has been actually exposed to the ODC concept as well. And this is just to list some of the proposed activity in 2026, that we now also developing the website, and also now as the initial phase to um, provide the data from academic hospital, that now we use the stroke data to be mapped of yeah as an initial activity. And now we also try to convert the hospital data to ODSC or CDM across the ESS affiliation hospital, the academic health system, which is currently we have 9 hospital on the network. Okay, so yeah, just to put a screenshot of the website that will serve as a platform to share informations, and also to enabling us to showcase all of the activity. Yeah, slide please. So, yeah, so this is just an example of the stroke data that now we currently do to be an example of the use case. We use the data from academic hospital for the stroke from the year 2024 to 2025. And additionally, we also um, have data from the Sarjito Hospital, which is the largest hospital in Yogyakarta, and try also to map this. And this data is relatively longer than what we have in our hospital. And this is also the additional activity that we would like also to do. And beside that one, we plan to have also the technical workshop to improve our own capacity, as well as also then to have the real use case that we plan to be on started on July until yeah September, to start the clinical documentations, and also to map the data that we have been actually selected. And we expect that this activity will also improve our understanding as well as capacity to this ODC concept. Okay, next slide, please. And yeah, this is the conversions of hospital data to ODC or MOP CDM across AHS affiliated hospital academic health system. Uh, we will use the hospital visit from the electronic medical record, and also the data claim from the National Health Insurance Agency from 6 affiliated hospital, and the time frame between 2017 up to last year. with the total claim about 1.9 millions, representing about more than 30,000 patients. And this is just to listed hospital that are on the network. Basically, it's ranging from the central level hospital owned by the Ministry of Health to the district hospital owned by the district government, as well as also the university hospital. Okay, so we are currently mapping to the OMOP CDM, and hopefully this can be the first use case for us. And we are now also try to expand the collaborations across Indonesia, and also to build the partnership with the global ODC community. And we expect that we can participate also on the ODC event and submit either the poster or probably other form to the APAC 2026 symposium. Okay, I think that's all, and we are very happy to join this network, and we thank you to all of you that basically very important for us that then support us to be this wonderful network, and hopefully then we can also contribute to something that impactful to our community. Okay, I think that's all, and thank you very much. Yeah.
Thank you, Lafan. Lafan, I have several questions to ask. And first of all, I'm very excited to like collaborate with Indonesian chapter, and hopefully we can see in person soon. Like I have one question. I mean, like several questions. I see you guys are doing a ETL and almost CDM mapping for stroke data. Is there any reason why the disease entry is more like specifically focused on stroke data? Like, um,
Thank you, Jiwan. Yeah, basically, we have also other data, but usually it will be also necessary to um well, I have an agreement with the clinicians, and
mhm,
the stroke data is the things that currently on the process right now that we have basically agreement before. So this is the things that we will do to start with this initial process. But of course, it's also open for others, and hopefully if we have already this stroke data, it will also initiate other data as well. And
mhm,
I think we need to have an example, real example, how it will works. And I think it will be also very important for other clinician to see the meaningful use of this data. And I think it will be also then able to interact with them as well. So hopefully this answered the questions. Yeah.
yeah, thank you. That was enough.
Yeah.
Song, I can see your hand raised.
Yeah, thanks, John. I have a follow-up question to this. So, look, Lafan, is the stroke data a registry, or are you filtering from your EMR data?
Mhm,
So it's from the EMR data. Well,
Okay.
actually, I've been also on the discussions before with our team members and also the colleague from TMU. We actually have several registry ready, but as we understood, the registry probably not as complete as what from the electronic from the medical record. It is why then, as a starting point, then we will use the
mhm,
data from the medical record
EMR.
directly. Yeah,
Mhm.
but we
No, I think
currently,
this is
yeah, please.
yeah. Go ahead.
So we actually have several registry ready, like the cancer registry and also
Mhm.
other disease-specific registry. But yeah, we don't know yet how then to utilize this in terms of the this ODC, but we have it also. But as we understood from the conversations, it is better to use the raw data from the medical record. It is why then for the starting point, we choose the stroke, which is we already have an agreement with them, with the clinician especially, and we started with this. Yeah.
Yeah, so starting with small therapeutic areas is
Mhm,
actually a good approach, especially if you need to persuade internal
mhm,
stakeholders. So I
Yes.
think the initial step you're taking is a very good model method in implementing or adopting OMAP in your nation
mhm,
and in your
mhm.
organization. One more question, and I'll hand over to Cynthia, I think, who has her hand up as well. Lufan, for the larger conversion over to OMAP for your affiliated hospitals, right?
Yeah.
Are the EMR data all stored as a single database, or are they being stored as separate databases for each of the hospitals?
So they are spirited. Yeah, it's basically on premise of each hospital.
Okay, that makes sense.
Yeah.
Great. Do you have any plans to integrate all of that into a single database, or will you be keeping it as a federated model, so separately?
Oh yeah, I think it's still on the Spirit database, but we try to basically extract, especially the administrative data into the single one, especially related to the data claim. It has been actually tested to be integrated from several hospitals, but for the clinical data is still on their premise.
Maybe one last question related to this. Sorry to take up so much time. Is the EMR systems that each of the hospitals using, are they all different or are they all the same? Or some
Uh,
same, some different? Go ahead.
Yeah, they are different. They have different vendor.
Okay. Okay. That totally makes sense. I guess then the integration aspect will be more of a mid to long term plan rather than a short term plan. Thank you. That's all.
I think
Cynthia?
Fadila would like to
Mhm. Oh
answer
yeah.
some question also because Fadila is actually working with the academic health system.
Mhm,
Yeah, maybe to add some context, from the six hospital, there is already an agreement for data sharing
mm,
since 2021, and we already collected some of the data administered from 2017 to 2025, but very minimal. It's on just the hospital visits. But so the way that we wanted to proceed with Odyssey is because we wanted to find which data model that we want to use. So it's halfway ready, but the AMR is managed separately by the hospital. It's
mm.
not from yeah. So it's not
Thank-
that probably not very long term. Probably in 1-2 years we can proceed.
Sounds good. Thanks for the additional information.
Okay, hope that clears.
Cynthia?
Oh, yeah, thanks. Very exciting development. I think, isn't Indonesia like the fourth most populous country in the world or something like that? So
Yes,
it's great
yes,
to have
right.
bringing in data from that such a large populous country. Do you anticipate how much of the data is in like your local language, Bahasa, is it? And what you think that's going to be a challenge?
Yes. Yes, right. I think most of the data is in Bahasa Indonesia, although now we adopting also the international standard like the SNOMED city and but yeah, mostly the data is in Indonesian language. But I think this is the things that now we are considering to be improved as well to standardize, including also to adopt the international standard.
Mm.
Right. Okay. Well, I see that you were hoping to do it in 3 months, did you say? You might want to buffer in a little bit for your language challenges. That's it. Thanks.
Cynthia. Um, I have another question about the health system in Indonesia. Like, is there only one national insurance system in Indonesia, or are you guys covering like different multiple insurance systems?
Yeah, nationally, we have a single pool, the National
Oh,
Health
okay.
Insurance,
Mm-hmm.
and now the coverage is about 98. yeah, 98%. So it's more
Wow.
than 230 millions already actually part of the national health insurance member, and the rest is mostly from the informal sector, which is actually not easy to be captured. But mostly Indonesian people is actually member of the national health insurance.
Oh, okay. Thanks.
I
Oh,
think it's
we
the
have,
largest in the
yeah.
world, probably. Yeah, the largest the single pool in the world, if I'm not mistaken, with more than 200,000 yeah members.
So,
Thanks.
does your hospitals, is it only hospital data, or do you have like a polyclinic data feeding into the hospital database?
Um, so far, we collaborate with the hospital, but in our health system, there are also the primary health centers. Uh, and it's actually more, but it's not yet on the on board. But we basically also may include them also if yeah, then this example from the hospital are, yeah, basically if we have real example, then we can basically also try to engage them also, because I think they are also very interested to join on the network.
Yeah, we have like several people hands up. So Shid,
Sayed,
sorry, Sid,
Asif Sayed.
Sid.
Yeah,
Yeah,
Dr. Asif
Sid.
Sayed.
Hi.
I work for MD Anderson Cancer Center in Houston, based in Chicago. So your health system in Indonesia, I mean, is it fee for service like the model we have in the US, or it's like completely nationalized services where the consumer or the patient don't have to pay? Because if you have fee for service structure, obviously you need different standards for payment mechanisms and valuation of services and those kind of things. And you already mentioned SNOMED, for example, or even ICD. So if you can shed some light on that, that might be something that might ease off your journey in that direction.
Yeah, those who basically become a national health insurance member, then it's for the hospital level, it's actually based on the DRG system, and it will be covered by the insurance. And for the primary care, it's based on the capitation, which is actually also the responsibility for the National Health Insurance Agency. So it's all under this scheme. But there are also some private hospital that use the fee for service.
Okay, thank you very much. That's good to know.
Lastly, Karthik.
Yeah. Hey, good morning.
Hi. Good morning.
Sorry if this was mentioned already in the presentation. I might have lost a bit, but there was this initiative of Satu Sehat in terms of bringing all the healthcare data into one singular place, right?
Yes, yes.
So how is this connected with that healthcare data? Are you also converting that into OMOP? Because we had this conversation a long time ago with Setyaji, who had visited in Singapore, and we were asking him how they plan to use this data for research. So I'm wondering if what you are doing is connected to that sort of initiative.
Yeah, well, basically each hospital may have link with the Satu Sehat as well. But yeah, for this, I probably not really aware of the current situations. Maybe Fadila can help to answer also, but each hospital is basically linked with the Satu Sehat.
Yeah. So for the national guidelines right now, each hospital has to have electronic medical records that send data to Satu Sehat, the national, through Fire API. And as of right now, the data is collected by the government, and it's underutilized, but it's on Fire server. Yeah, but maybe does that answer your question?
Sort of, yeah. I was just so again, it's kind of answered. So you're not using the Satu Sehat data yet. That's what I wanted to understand. So you're individually going to hospitals and not the centralized location where you're collecting the data. That's fine. About the fire server and fire to OMOP and stuff, I mean, we can talk later. This is going to be a long conversation if we start that now. We will reach out to you offline and we'll talk about it later. Thank you, though.
Yeah, thank you so.
Yes, Karthik, please email our talk online with Lafan and Dila for the furthermore conversation. And yeah, that was really rich conversation. And I believe a lot of people are very interested in Indonesian chapter and very much excited to collaborate. And for our collaboration, discussing about the collaboration. We have now we're gonna talk about the 2026 OHDSI APAC study kickoff. And before I hand over the floor to Nicole, I want to briefly say that going forward we will be using the both community call and the scientific forum as a space to discuss and share progress of the 2026 OHDSI APAC study. So if you're interested in getting involved, also who wants to, I believe Indonesian chapter are very interested in joining this APAC study too. So anyone who wants to get involved, please make sure to join us on the first Thursday, which for the scientific forum, and the third Thursday of every month for the community call. So this is the schedule that we are planning to do to progress our APAC study. So today Nicole is gonna give us a kickoff session, and next month for the scientific forum, I'm gonna give a little speech about explaining the theory on characterization and treatment pathways. So please, guys, follow this schedule to get involved in the APAC study. So I think I'm good for now. I think I did all my role for today, and I'm gonna hand over the floor to Nicole. Hi, Nicole.
Hi, everyone. Thanks, Jiwon. I'm just going to share my slides. Let's hope that works. All right. Everyone seeing my slides?
Yep. Sounding
Great.
clear.
Excellent. Well, thank you for that introduction, and really great to see what's happening in the Indonesian chapter as well. So welcome to the APAC community. It's great to have more people involved, and we hope that you'll also be able to join this APAC value study that we have proposed and are going to work on together over the next 6 months or so, hopefully in time for the OHDSI APAC meeting in Korea. So what I thought I'd do today is give a brief overview of the what we're calling the value study, which is a global characterization study of valproate utilization and exposure among men and women of childbearing age. Now, there is a very intentional use of the word value in the title of this study. And what we're really wanting to do is show, or at least demonstrate, how a OHDSI network study can help to show value for different aspects of the work that we do. And by value, I mean, value in terms of answering specific clinical questions, value in terms of designing a study that could be used for multiple purposes. So we'll talk about a little bit about what we want to do to springboard off of this study. So what else can we do by setting up the infrastructure of an OHDSI characterization study, but also the value of working together and learning as we go along in a practical sense. So by doing this study, we're hoping you'll all come along the journey with us and learn how to practically do some of these studies that you will have often heard about the results, and maybe heard about the methods that people use to get to that result, but may not have had the opportunity to participate in a study and to work on it in the weeds, down in the depths of the analysis, and really see how to build cohorts, how to use those cohorts to do a characterization study using Atlas, using Strategos, and using the other tools that OHDSI has available to us as researchers. So I really hope that by doing this study, you'll all find some aspects of value along the way. So really excited to be doing this with you all. So let's try to move to my next slide. So many of you will have seen this diagram. It's a very standard slide that we often see in OHDSI presentations. And it really demonstrates what are the types of questions that we often want to ask in clinical research. And those are three things: clinical characterization, patient-level effect estimation, and patient-level prediction. And for this particular study, we're really focusing up at that clinical characterization study question. So we're asking, well, what happened to them as a population? So what happened in the real world for some clinical question? So the clinical question, as we know, is valparate. So we want to know what happened over time to a group of people who were exposed to valparate, or what people were exposed to valparate. So it's really a clinical characterization question, and we're asking that because there's been some warnings around the use of valparate in particular populations, so in men more recently, and women of childbearing age, because of particular consequences that may be associated with that exposure. So conditions of the child as they grow, so neurodevelopmental conditions. So I'm going to, I have presented this before, so I'll skip over this really quickly. But when we're talking about clinical characterization studies, we're actually asking questions about who's been prescribed, what type of people have been prescribed, what were they prescribed, has there been changes over time, do those practices conform to the clinical regulatory authority, warnings and so on. So we're really asking that question about who uses what, when do they use it, and what are there differences in different subcategories of the population. And this is a study we did quite a while ago now, where we did a similar study, but looking at pediatric use of medicines across different countries in Asia Pacific. So the last time I presented this as well, I put up these different criteria for deciding on high impact studies. And as most of you will know, this particular study came out of that process where we asked the community to give us some questions that are of importance to them. And then we landed on this particular question because it really fit this clinical, or this criteria about what makes a high impact study. And looking at this particular valparate study, we are able to do it. It's actionable. We can look at, this quite simple question, but it does have a really, high impact. We have the methods available to be able to do this robustly through the OMOP CDM and our OHDSI tools, and it is feasible, right? We can do this across multiple APAC sites, and it's a simple-ish study that will help us to then springboard to more complex studies as we build up our expertise. And the really important thing, at least for me, is that this study will have value more broadly. It will leave our network stronger than it was before. We're moving the dial and hopefully bringing people along with us and building capacity to do our own studies, right? So if you have a question, maybe you're not interested in valproate, but you might be interested in, you know, anti-Parkinson's disease, for example. You can use this process and use all of the tools that you learn along the way for valproate and do the same study for another drug of interest to you. So it should mean that we're able to do lots more studies that are of interest to the community. As I mentioned, valproate itself has had quite a few warnings along the way. The first warning about a potential side effect was, I can't remember the date. I think it was way back in maybe 2019, I think, or 2018, where the use of valproate in girls and women of childbearing potential was warned against by multiple regulators across the world, and they really suggested that it was not to be used in pregnancy or in women of childbearing potential, but if it was used, that it should be used with a pregnancy prevention program as well, with the aim of minimising pregnancy exposure. The reason why, you know, this is particularly relevant in our region is that it's really unknown, at least to me at this stage, what has happened across the APAC region in terms of the warnings themselves, and what has happened in response to those warnings, either in your own country or in as a response of the European Union warning of these events as well. So the Darwin EU network, which most of you will know about, Darwin EU is run out of Europe, and they did this study where they looked at the use of valproate in women of childbearing age and really saw a very dramatic change in the use of valproate over the years, and you know, a change in the type of medications that were prescribed. So really, we're trying to emulate this study across our Asia Pacific region. What's also very interesting, and why this is of particular importance in Asia Pacific, is that this study suggested, and you can see the highlighted region down here, that the use of valproate is actually quite, you know, is quite high in the Asian countries. So it's really important that, you know, if there is a safety issue, that we demonstrate the potential use in these countries. As I mentioned, the safety warnings around women have been, you know, around for some time, but more recently there have been safety warnings about the use in men who conceive babies at least 3 months prior, or the exposure to valproate in the 3 months prior to pregnancy. So there's been a warning in the UK and also in Australia in response to that UK warning as well. Possible risk of learning and communication and behaviour problems in children born to men exposed to these medicines. So what are we going to do in response to all of this? Well, we're going to embark on a collaborative, large-scale, federated network study to examine the utilisation of valproate. And we're going to do that in both men and women of childbearing age across the data sets in Asia Pacific, but also globally as well. So we will hopefully include some other countries as well as we go along. And we're going to describe the utilisation patterns, the trends and population characteristics to understand how those safety warnings have translated into real-world practice across the different regulatory jurisdictions. So how are we going to do it? So G1 has already shown you our calendar of events. So we have a very ambitious calendar where we're going to spend the next 5 to 6 months working together every month to do aspects of this study, from conception all the way through to interpretation of our results. And we're really hoping to get all of this done by August. But to have that happen, we're going to need some input from you all. So we're really hoping that everybody will work together and do some homework before the next meeting. So April is the kickoff, and we're here right now in April at the kickoff. And what I want everyone to do, is some homework for us to review the treatment guidelines and the regulatory agency warnings in your region. Okay, so we want everybody to get involved in your node or in your chapter. Get together, or communicate in however you communicate with each other, and look up your regulatory warnings around valproate. Have a look at what your regulatory agencies have said about either men or women in the use of valproate, and review that for us and pop it in. If you've got links, pop it in a document that I have on the APAC Value Study team site, and let's start to work together to see what different countries are doing, what warnings have been put out, what have they warned about, what has been the regulatory action, has it been a change to the clinical treatment guidelines, so what has happened in response to these warnings. So I want everybody, if they can, to upload the information into this spreadsheet that I've got on the team site, and we can start putting all of that together. And that reminds me, if you haven't got access to the team site, G1, how do we get access to the team site if they haven't already got it? Is it through the OHDSI website?
So I believe everyone who joined the Teams call, they have access to the Teams channel. But
Okay.
I just found out we created the 2026 APAC Value Study, and if and Galen, do you have access to this Teams this channel? Because this channel looks like a hidden right now, so maybe we have to add every member, I guess.
Yeah, I created the channel.
So
but
when you create channels, sorry, when you
It's
create
open to everyone, right?
oh, it's not open to-
it's hello?
Yeah,
Hello?
go on, so.
Yes.
Yeah. So when you create channels, it's hidden by default. You need to go in and make it show. So
Yeah.
it's not a matter of some people having access or not. It's more of a matter of each of the individuals navigating in your own team settings and making sure that the channel you want to access is in the shown status instead of the hidden status by default.
Okay, so everybody should have access to it, but if you have any issues, reach out and we will get you sorted. So that's my challenge to you all before our May call, which is on May 7th, where and then we've got the community call on May 21st. So if you can all get together and get that information ready for us in May, and we can start to talk about it. So on May 7th at Scientific Forum, G1, as you mentioned, we'll be talking about the characterization and treatment pathways, because that's one of the things we would like to look at, what's happened with valproate over time, what treatment pathways have changed, what do they look like before and after the warning, and then we'll review all of those treatment guidelines and warnings in our call on May 21st. And then we'll give you new homework in those calls, where we want to start thinking about what's the research question. We'll then finalize the protocol, and we'll build the characterization treatment pathways in Atlas. We'll do that all together, and then we'll execute and troubleshoot any problems with the execution of the package, and then we'll start to look at the evidence in August. So that's where I'll leave it. Although, hang on, I was going to say one thing. What we're doing right now is the clinical characterization, and by August, hopefully, we'll have done it, right? But as I mentioned right at the very start, all of this is really setting the scene to be able to move on to more complex studies. So we'll have some cohorts around the use of valproate. We'll have cohorts for men and women. We'll then be able to potentially use that baseline information to then design population level effect estimation studies where we can start to now compare outcomes of those treatments and look at different outcomes over time. And I did think I saw Bianca Varney online today. So Bianca is a stellar researcher from Australia who has been working on this exact question in some data in Australia. So it's great to have Bianca on board, and perhaps she can go forward with this study in the future. So I'll leave it there and open up to any questions. Thanks, Jiwon.
Thanks, Nicole. I'm very happy that we have a homework to do. And I have one question, because everyone, this year we opened the APAC study to everyone, right? So everyone has a responsibility and everyone can have an interest, but they maybe some people doesn't have enough passion or responsibility, I don't know, to engage the whole study from start to the end. So I kind of wonder what can individual researchers expect to gain from 2026 APAC study? If they have really strong incentive to the researcher, I think that would be a great motivation. So is there any thoughts of that?
Oh, I've got lots of thoughts. Do other people want to chime in here and say what? I mean, Jack, perhaps you could suggest what some of the value was for you in participating in prior studies as an early career researcher, and what parts of the process.
Yeah, I think I would first just want to encourage everyone to follow the process through from start to finish. It's quite easy, I guess, in Odyssey to jump into a project and then sort of, I guess with the US, the time zone stuff can get a little bit difficult for people to manage if they want to participate in studies. So following the process through is probably my first thing that I wanted to say. And then, just seeing how each of the parts fits together is super valuable. Once you know how to make some cohorts, you can, soon learn who to reach out to do the next part of your study and whatnot. So I think following the process through and meeting people along the way should be enough of a motivator. And then you can, join into the network and meet some colleagues who will help push you further with your other research and whatnot as well. So there's lots of motivating factors. Just stick with it is the thing I would say.
Thank you, Jack. Actually, I experienced a exact same thing from last year. So as long as you stick here with other people, with a lot of collaborators in APAC, you'll get a lot of networks. Also, you can get a lot of insights in a research aspect too. So and you could never do anything by yourself. That's what I think. If you work together, you can do anything. That's my life motto, I believe. So
True.
maybe that gives you guys a lot of motivation, that from Jack and me. And anyone else?
Fook, I know Fook is online as well. Sorry, Bianca,
Fook.
you go ahead.
Bianca. Hi, Bianca.
Hi, just want to say thank you for the wonderful introduction. I'm really looking forward to being on my first Odyssey project. Two small food for thought things that I've had in for the valparate work. The first was there's a lot of interest now in men that discontinue valparate because of these new regulations, and they're based on a study that was not very well done and has been disproven by a few other studies. So what's the effect of people that are discontinuing like the first line of treatment for epilepsy on their epilepsy? Like, can we see if there's any kind of, safety issues in that? And just the second thing of interest when I was talking to a clinician was that although like those regulatory things have come out like in Australia as well, they eventually made their way here. I've heard that clinicians don't take it very seriously here, and I'm not. I was interested to hear that. I'm not sure that they're like talking about this information with their patients. So I, just wanted to flag that there might be some discrepancy to like what's happened in the regulatory space versus what we might actually see based on like, clinicians' perspective of that data.
Yeah, that's a really good point, Bianca. And I think that's another reason why everybody should come along on this journey throughout, no matter what your background or expertise is, because we need those insights, like Bianca was suggesting, like what are the clinicians thinking about this? What are they doing in practice? What are the pharmacists doing? What are the medical doctors? So I think it's really important that you don't have to be involved only because you know how to play with the data or you know about the Odyssey tools. We really need those insights from clinicians and patients, even the regulatory agencies, and all of that needs to come together so we have a really good interpretation of the data. It can't just be a data exercise. It really has to involve all of those groups so that we have that knowledge translation at the end. Yeah. Thanks, Bianca.
Thanks, Bianca, for speaking up.
Yeah,
Hi,
Fook,
Fook.
I was going to see if you could chat just about, so Taiwan has been doing some great work in this area, and Fook in particular, and they'll be doing a lot of that background work on helping us design and create the study. So Fook, what do you think?
Yeah, thank you for your sharing. I think that's a very great initiation for the Pamploy study. I've been working with Nico and reading through the Australia guidelines about the epilepsy. Also, I also have an opportunity to work with Jason and to see through the database of the valproate and kinds of the anti-seizure and epilepsy drugs. So I think it is very, very interesting. And the way Nico share and get everyone involved into this study, that is like, no matter how you don't know any Odyssey stuff, you can like get involved from the very beginning of the study. And if you don't have any problem, like want to ask me about how to work with the database or how to run like the very simple definition, I can help in person. So thank you.
Okay, thank you, Fook.
Participated for helping. So everyone, if you have any question, please bother Puck. So we have Pei. Hands up. Yep.
Hello.
Hi.
Can you hear me? Yeah. I'm from Ilalili, Japan. So this study sounds very exciting. And then could you please let me know how to can get involved and contribute to the value study. So because I believe I already have access to the community channel, but the value study channel seems to be hidden or on my side. So yeah, should I contact someone directly or
Oh,
yeah?
yeah, I can answer that. I just
Okay.
unhidden the channel, so maybe yeah, I just did it, so you can. I'm pretty sure you can see the channel right now. So yeah.
Okay,
And also, Gan is a coordinator of this value study. So anyone who has trouble with getting access to Teams or schedule or joining the call, please contact Gan. And Gan has, yeah, hi Gan.
Thank you, Jiwon, for unhiding the channel. And I am sure that if Jiwon did it, then Pei could see it too. But if you don't see it by any chance, just send me an email or just hit me up through Teams or like you can just find me anywhere. So just tell me that you can't see the channel. Or if it's easier for you, you can just send me an email if that's easier. So just let me know.
Okay, thank you.
Thanks, Pei. Okay. Now we are out of time. Like it's yeah. So thanks, Nicole, and thanks, Lafon and Della. Thank you, everyone. So we have homework for next community call, and I will have a presentation on scientific forum about sharing the studies about characterization and treatment pathways. So please, guys, join the scientific forum too, and yeah, and also keep every updates in the Teams channel and a value study channel. So yeah, that's it. And hope you got. I will see you guys next few weeks. In the next few weeks, and bye bye. Have a good one, everyone. Bye.
Thanks,
Ciao.
everyone. Bye.
Bye,
Bye.
have a good
Bye.
one.
Bye bye. See you.